Hi, I'm Dr. Ross Carter, and welcome to the Medical Influencers Show. Today, my special guest is Dr. Moshe Dekel. Welcome to the show today.
Thank you. It's great to be here. I'm looking forward to our conversation today.
I am too. So today we're going to be talking mainly about fatigue, brain fog. And you are an expert in helping people that have problems with fatigue, correct?
Yes, I am an expert in that. I've been treating my patients holistically with this kind of issues and other for the last 20 years out of my 39 years in medical practice in the trenches, so to speak.
Have some water. Awesome. Sorry about that. I need to get some water. So, you said 39 years. Is that correct?
In private practice.
Wow, that is a long time. So you've probably dealt with quite a few people that have a little bit of problems with their energy, correct?
I find that this is really a ubiquitous issue. A lot of my patients coming in and say, listen, I can get up in the morning, and when I get up, I have a little energy, and then at 2 o'clock I crash, I have to take a nap, or I come from work, and the only thing I can do is just crash and do nothing. I can barely have dinner. Obviously, not everybody is like that, but that's the extreme case.
Right.
And it's up to me to actually decipher the underlying causes of what's happening here and what we can do in order to resolve it.
All right. So when somebody comes to you with fatigue, what is the first area, or what's the first thing that that should be addressed? What do you look at when somebody says, "Hey, I'm having some problems," and you say you can help them? Where do you typically look first?
I look first at lifestyle and diet. These are one of the most important things that we can do with any patient, because a lot of us, unfortunately, don't eat the way we should eat. And even if we do, a lot of us have incomplete digestion, issues with not enough hydrochloric acid in the stomach, not enough digestive enzymes, not the flora, the gut flora, the probiotic environment in the gut is wrong. So really, most of a job of a holistic doctor, the way I see it, is really listening to my patients, because they're going to tell us the story. And what I need to do is kind of take the bits and pieces from that story and say, okay, how does it apply to clinical medicine? And what can I actually find out, to ameliorate, to make it better, and to resolve the problem? Because, we don't use prescription drugs, which don't help anyway. So we find out what the issues are and how to address them.
I think that sounds good. So how does a person know that they should see someone if they're feeling fatigue? They could go, well, I'm working a lot or whatever. How does a person go from the point of, I need to check, get evaluated and determine if there's actually something going wrong? How does somebody know?
That's a great question. And unfortunately, a lot of my patients have seen 5 to 10 doctors before me and unable to resolve their issue, because what they do is they take blood tests and they figure out, well, let me check the thyroid, because the thyroid is an issue, but the thyroid levels come back fine. So they continue to investigate, and they find out, well, not only I'm fatigued, but I'm so depressed about it because I don't have a life. So now they have a prescription. Oh, right. Thank you very much. I found something, I can give her a prescription, and I did my job. So most of my patients have seen a multitude of doctors, and they find people like me, practitioners like me, probably by sheer, how would I say, they just it's the last straw. Is they just do a search for alternative medicine or holistic medicine, because they say, listen, I'm taking 5, 10 prescription drugs, I'm feeling worse by the day. So that's one way they get to us. Another way to get to us is because they talk to other people, friends, family, acquaintances, etc., and they find out, what, I had a similar problem like you, and conventional medicine didn't help me, unfortunately, and I found a holistic practitioner, and that's how they find us.
Gotcha. So that's how, well, that's typically, like you're saying, mainly referrals. Is that correct? Usually, is that the main way?
I would say the referral is about 50% of our patient population. There is really searches, internet.
Oh, so people
Internet.
are finding you online.
Oh yeah, they do a search, they found online, or even on social media sometimes. I mean, I have thousands of followers. They know me pretty well for the last 40 years or so. They know what I do, and they kind of communicate within their community. And when somebody says, I'm fatigued, I'm this, I'm that, so they say, you know what, I think this doctor can help you. And that's how they find us.
Now, do you offer the ability to talk to you online or telemedicine wise?
Absolutely, especially now with the COVID mania.
Yes.
Yes, but even before that, because again, I treat patients from all over the country and actually international patients. So I like to do the Zoom, which is excellent because I like to see my patients and very probably like to see who they're talking to.
Right.
I think the part is I feel their energy, what they're all about. So I like to do Zoom or Skype, whatever they have. But I have no problem with doing a phone consultation. I mean, today I can order labs in advance, have it on my screen, and really hone in. It's almost as good as face-to-face, especially in holistic medicine. Almost
right.
face-to-face.
Wow, that's awesome. So
Yeah.
once somebody finds you and they say, okay, I'm having this problem with my fatigue, you said that you start with evaluating them. How can you do a complete evaluation online like this?
Yes, I can, because especially depending on the scope, because the scope is pretty broad. Okay, if they don't have recent labs or they don't have enough labs, I would order labs for them because I want to see what the blood chemistry is. I want to see the complete blood count. I want to see if they're anemic. Anemia can cause, of course, fatigue. Okay, I want to see their reserves of iron. I want to see what the adrenals are doing. I want to see what the thyroid is doing. I want to see if they're inflamed. I want to order CRP. I want to order homocysteine, etc. Because why? If somebody's inflamed, 99% starts in the gut. So now I know the gut is involved. I get the diet now. I say, okay, you're eating this, this, and this. And do you have heartburn? Do you have any bloating after you eat? Do you have constipation? Do you have diarrhea? Do you have any discomfort in the abdominal area? Because you see, energy is the result of the following: what we eat, how we digest, how we assimilate, how we burn, and how we eliminate. Okay, so we already talked about the first two. What do you take? What do you intake as food, for instance? I found out if they have any symptoms of digestive issue. And by the way, even if we don't have any issues with digestion, that doesn't mean we're out of the woods. Because in my experience, if you don't take at least digestive enzymes and probiotics, you probably have an underlying cause. So once I'm done with that, okay, so assimilation. So again, it's how we digest, how we assimilate, okay? Then how we burn. So what burns food? What makes energy in our body? Well, each cell has what we call mitochondria, which are the kind of factory cells that make what? Make energy. Well, who controls it? Who controls metabolic rate? The thyroid, a small little gland right here, the butterfly gland, that speaks to every cell in our body to tell what kind of energy to make and how much of it. However, it's not a standalone gland. We have the adrenal that works very, very closely with it, and I like to call them the Siamese twins.
Siamese twins.
Siamese twin, okay. We cannot just, I'm telling you, in my experience, if you find out, let's say somebody is a thyroid deficient, and you take care of it, by the book, perfectly. You get 100% on your test, A+, and they don't still do better. Why? Because you didn't support the adrenal. Okay, and we're talking about support, nutritional support, supplement support, etc. And you say, why is that? Well, what's the connection? Well, the adrenals are called the stress glands. Well, obviously we're stressed, and very few of us are actually taking the time to regenerate the adrenals. And if we don't have a good night's sleep, we definitely don't have adrenals that's functioning. The adrenals, as it's going down, take it down with it, the thyroid. And when I start conversing with my patients and kind of guide the conversation towards the thyroid to say, wait a minute, I just had blood tests. My doctor told me all my levels are fine.
Right.
What's the story here? That's a good point. What's the story? The story is that 80% of underactive thyroid do not show it on the blood.
Really?
Absolutely.
That's a lot.
Absolutely. And there's enough information out there, there's enough data to support that. So just because you have normal TSH, normal T3, normal T4 doesn't mean that you're not underactive thyroid. Because if you don't have energy, if you're brain fog, if your temperature is on the cold side, in other words, if your temperature is in the 97 range or less when you get up in the morning, guess what? You're thyroid deficient, because the thyroid is also the thermostat of the body. So if it's under performing, you're going to be cold. You're going to be cold. I have patients that walk around with temperature of 95. 95 is like almost 4 degrees below normal.
Right.
Nobody raised any question about it. So let's assume we now focus 4 degrees over normal. That's 102, 103. Is that
You got a fever, you're in trouble.
So why on the other side, it's not a problem? Every degree that our body is functioning at less core temperature, enzymatic efficiency goes drastically down. Enzymes work exactly at 98.6. 97.6, they work, but 80% capacity. How about degree less? 20%. So everything is related. Hair loss, especially for women. Constipation. Irregular menstrual cycles for women. Infertility in women. High blood pressure. All these can be part of underactive thyroid.
Wow. So how do you check a thyroid if you do a blood test and it says, hey, everything's fine, then how do you know your thyroid is a problem? I like the question. I did like the point where you said about the temperature. So what you're saying is if you could do, anybody at home could do this, where they could take a thermometer, I guess a digital one, and check themselves when they wake up in the morning. Is that correct?
That is correct. And if they continuously be below 97, okay, most likely they have underactive thyroid. And if it's 96, I can guarantee it.
And that's oral. Orally. Okay. Well, I'm going to do this test myself.
Orally is fine. Again, axillary temperature is going to be slightly lower.
Right.
Actually, oral temperature is 98.2. Rectal temperature is 98.6 because it's core temperature. So oral cavity is slightly less. Axillary is slightly less. But again, oral, if you check it and it's 97, 96 point something,
So if it's below 98 orally, then there's something going on.
Below 97, I would say.
What's that?
Below 97.
97, below 97.
Yes. Then we have an issue. And we have to explore it. So you say, well, how do you do? I mean, the blood chemistries are fine. So what do? You kind of, yes, I give it thyroid support. And I can tell you one thing. I tell my patients, if you don't feel better in 2 weeks, I missed something. If you do what I tell you to do, and you don't have at least 50% improvement of your original symptoms, I missed something. And I don't like to miss anything. So I say, you need to call me and let me know that, hey, I don't feel any better. And then I kind of have to reassess and say, okay, what's going on? So I'm continuing to question, ask him. And I will, of course, look at the diet, look at the lifestyle, look at their sleep, look at everything else and see, did I miss anything? Usually I didn't miss anything. And therefore, all my patients really get better if they do what I tell them to do, which is kind of pretty remarkable, considering that if they just take medication, they're not going to do well at all.
So when you work with someone's thyroid, you're not giving them thyroxine, for example. Is that correct?
Excellent question. Thyroxine is T4. Now, T4 is not an active hormone. T4 has to convert to T3. T3 is the active hormone. So conventional medicine is giving T4, thyroxine, levothyroxine, that's T4. And it will help some patients, but some patients will not help. What patient will not help? Patient who have a problem converting T4 to T3. You say, what does it need? I mean, how does it convert it? Well, first of all, you need energy. Number two, you need enzymes, coenzymes, selenium, okay, zinc, and the energy needed to convert it, if you're not converting well, and especially if you're stressed, cortisol goes up when you stress. Cortisol stops the conversion of T4 to T3.
So your thyroid could be low because you're under a lot of stress because of the conversion problem.
Absolutely. In other words, what happens is the T4 can convert to T3, which is an active hormone, or if cortisol is up, it will convert to reverse T3. Reverse T3 is very similar to T3, but it's not an active hormone, number one. Number two, when it bounds onto the receptor, it blocks T3 from telling the receptor, hey, you need to go to work.
Really?
Yeah, absolutely. So all these little nuances we have to find out, and we need to adjust them. I see a lot of patients that come to me that they were diagnosed with underactive thyroid, conventional medicine. They were not put on adrenal support, but they put on thyroxine or levothyroxine or whatever. And the first months after they were given that, they said, wow, I feel better. So they come back to the doctor and they do another blood test, especially called TSH, thyroid stimulating hormone.
Mm-hmm.
Now, when they come back and they have good amount of thyroid in their system, the TSH, according to conventional medicine, is too low. Too low.
Okay.
The conventional doctor gets concerned that the amount of thyroid they gave them is too much.
Okay.
That's not good. You don't want to give too much thyroid. So what they do, they reduce the dose. 2 months later, they come back, they do another test, and the patient comes in, and the doctor looks at the test and says, you're perfect. TSH is exactly where I want it to be.
Right.
But the doctor says, the patient says, but I don't feel good. I don't have the energy. But the doctor says, you know,
it's not your thyroid then, right? That's what they're saying.
everything is here, and they will not give them enough thyroid. So anyway, the first one was correct. So what they don't realize is that the TSH, I found out over the last 20 years in holistic medicine, that patients who have normal active thyroid on supplementation, their TSH is going to be too low for the normal numbers. So in that respect, I pay attention to what the patient presents and not just the lab results. And
Makes
therefore, when they come to me, you know, I make the adjustment. Number one, I don't like to use T4 thyroxine, as you mentioned. I like to use natural, either adrenal desiccated thyroid, like we have nature's thyroid, we have nature's thyroid, and others that are actually desiccated gland, and they have 80% T4 and 20% T3. So even if you're not that good converter, you're getting some T3 to start with.
Mm-hmm.
Okay, and some patients do, if they do well on T4, live on T4, just adjust the dose. I don't want to make big changes, but if they don't convert, and sometimes you have to actually give T3. Because why? Because even if they don't convert well, the T3 in the combination of the glandular part is not enough for them, so you need to give T3. So everybody's different, and you have to follow them clinically, also with blood tests, but mainly clinically, because listen, I tell them very simply, You will know if you take too much thyroid. You will know. You're going to have tachycardia. You're going to have fast heartbeat, palpitation. And I tell them right off the bat, if you have palpitation, you have to call me. Because at that point, we're going to decrease the dose and find out what is the great place for you to be. Get the energy, lose the extra weight, get metabolic rate where it needs to be, get your temperature up where it needs to be, without getting into tachycardia.
Now, is there a bioidentical thyroid available?
That's what we're talking about. That's the one I use, which is actually made of a gland. Either the thyroid gland of either pigs or calves. Okay, so one of the most notorious one is called Armor Thyroid. Natural Thyroid is another one. It's the same ingredients, but just made by a different company.
Mm-hmm.
And or the bioidentical pharmacies actually get it in bulk, desiccated thyroid, and they can put it in capsule according to how much you tell them. So that's the bioidentical, specifically done by that. But the Armory is, even though you can get it in GNC, it's still natural. It's still natural.
Interesting. So when somebody has this energy problem, those are the two areas, the thyroid and the adrenals, that should be addressed. Now, you haven't discussed much about the adrenals.
Yeah, the adrenals are very important because we beat up on them on a regular basis just because we live in the 21st century. Not even talking about COVID and all the stress and not work. I mean, even pre-COVID. And if we don't support them with de-stressing, meditation, good sleep,
Mm-hmm.
we need good sleep. We need at least 5 hours of straight sleep out of the 7 or 8 hours that we need in order for the adrenal to regenerate, to kind of replenish themselves. And if we wake up in the middle of the night because we don't sleep well, or we have to go to the bathroom, etc., that is not helpful to the adrenal. The good news is that you have supplementation that will support the adrenal to the point of being normal. So the idea is really, the analogy I like to give to patients is the following. Our body is being pulled forward by 2 horses,
Okay.
the adrenal and the thyroid. If I just feed the thyroid horse and I don't feed the adrenal horse, you're going to move forward at the speed of the slowest horse.
Mm.
So we need to support both of them.
It makes sense. It makes sense. Excellent. So when you said the thyroid you can check for, how do you check your adrenals?
The adrenals you can check with saliva. Okay, you can check saliva cortisol level in saliva.
Mm-hmm.
Usually like to do it 4 times during the day. So it's a spit test. You have a look 4 different containers that you spit in them. Let's say when you wake up around 11 o'clock, around 3 or 4 o'clock, and before you go to bed. And we look at the curve of the cortisol. Cortisol, it's interesting because the adrenal actually wakes us up because cortisol start to climb up at around 5 o'clock in the morning. It reaches a certain level, we wake up.
Mm.
Okay.
Got it.
So it really spikes in the morning, stays like that a little bit, and then start to decline and goes almost to very little before we're ready to go to bed. So that's a normal curve. And sometimes we find that it's a very flat curve or reverse curve or whatever, because again, if it starts to climb at night, guess what? You're not going to sleep because the body responds to it and say, hey, it's time to wake up, it's time to go to work, it's time to go to eat. So anybody that wakes up at 3 o'clock in the morning and raises the refrigerator, most likely it's adrenal.
Now, for adrenal support, how do you support the adrenals? Let's say if they're having spikes of adrenaline in the evenings or when they wake up.
Good question. 2 types of supplements.
Mm-hmm.
Number one, we use what we call adaptogens. Adaptogens are certain nutrients that actually help stabilize the activity of the gland. In other words, an adaptogen like ashwagandha, rhodiola, cordyceps increase the gland activity if it's too low. But
Okay.
if it's too high, it levels it down. So these are called adaptogens. So the supplement that I use are a combination of adaptogen and adrenal gland, desiccated adrenal gland, again made from animals, either from calves, okay, or pigs that are specifically designed for that. And
Mm-hmm.
that's how you support the adrenal. Now, also, you say, well, how do you know how much? That's a great question. How do you know how much and how when to take it, et cetera, et cetera? Well, first of all, you take adrenal and thyroid as soon as you wake up.
Okay.
Okay. Then what you do is you take another dose depending on how the energy curve is. That's why it's important for me to ask them, how's your energy? Give me the curve. What's happening? Most likely, most people need another dose at around 1 or 2 o'clock in the afternoon to
Of both.
prevent this. Yeah, usually both. Usually both. And you say, well, how do you know? I do what we call muscle testing, kinesiology, and I find out. So everybody is different, but the body knows exactly. It's totally subconscious, and it gives me the right product that I need to use to the quantity that I need to use and how many times a day I need to use it.
Mm.
Okay. And I ask my patient to give me a report, either via email, text, or a short conversation, how they're doing. Because if they're not doing better, we need to fix it. We need to adjust it. We need to find out why not.
Mm-hmm.
Now, another important part of energy is quality of sleep. And you know that insomnia is a huge problem in the United States, especially Western society. Huge problem. If we don't sleep, we just don't repair and we're going to break down. And we need to find out why we don't sleep. Okay, a lot of us cannot turn off the loop in the brain. Okay, what I'm going to do tomorrow, what I didn't do today, what all these thoughts that we didn't put to bed, so to speak, before we went to bed.
Mm-hmm.
So I suggest to my patient, you know what? Few mantras to say before you go to bed. 3 of them. Number 1, I forgive myself. Number 2, I'm going to have a great night's sleep. Number 3, tomorrow's another day. Shut the computer. Okay, and also don't have anything stimulating before you go to bed, like watching a very action movie or a scary movie or whatever, or even look at the news because they're scary.
Right.
You know, so avoid all this and really calm down and do, and we have to do relaxation exercise on a daily basis. Just kind of feel yourself. The problem is a lot of us have to do 2, 3 jobs a day to support our family. So who has the time for that?
Yeah.
And we take our body for granted. But the thing is, when they come to me, they realize, hey, I can't do it. I cannot take it for granted anymore. I need to listen to it because he's sending me messages. Symptoms are messages.
Mm-hmm.
It's up to me to help interpret to the patient what it means and what they need to do in order not to feel so miserable. So they have a great incentive to make some changes because, as you know, the hardest thing for us to do is what? Change lifestyle.
Right.
Change diet.
Got it. Wow, that's a lot to think about. So I like that. Yeah, good topic today because, I mean, I know so many people that have problems with fatigue. I suffer from it myself occasionally. So it's definitely enlightening. I need to get my thyroid and adrenals checked out myself.
Well, again, what you do is just check the temperature. I mean, it's not a bad idea to get TSH, T3 free, not total. Because one thing, we have a certain amount of hormone, whatever it is, in the bloodstream, and it's called total. Total T4, total T3, total testosterone, and on and on and on. That doesn't tell us so much because it depends on the active hormone is the hormone that is free, that's not bound to protein in the blood.
Right.
So I don't even bother with total. I said, give me the free. Give me what's the free level of T3, T4, TSH, and reverse T3, because sometimes reverse T3, if it's elevated, means what? Cortisol is out, and T4 converts to reverse T3, which is getting me down.
Beautiful. Nicely said. All right. Well, I think we've covered a great topic today. I think your information was very, very helpful. So I appreciate you sharing your knowledge with us today. So if somebody wants to learn more and talk to you, how would they go about doing that?
Well, they can go on my website, drdekel.com, drdekel.com, all right? Or call my assistant at 843-422-8328. And we can help them very quickly, even though they can be on the other side of the country.
Perfect. Well, that's wonderful. Well, Dr. Dekel, it was a pleasure speaking with you today, and thank you so much for taking the time to educate our wonderful community.
Thank you very much for having me, and we'll see you soon on a future broadcast.
Yes, thank you so much.